Good evening, everybody, and welcome to our webinar on clinical data and privacy. Tonight, we're going to highlight the impact of recent changes to the privacy legislation, and we're going to discuss some practical challenges in ensuring health information remains private and secure in the digital age. And tonight, we have a panel of experts from a range of disciplines in the healthcare space, and we're going to look at what clinicians really need to know about some of the changes and provide practical advice on how to minimise their risk when dealing with and sharing personal and clinical information. Good evening, everybody, and welcome to our webinar on clinical data and privacy.
And good evening, everyone. So I like to bring in a more practical perspective of how practitioners in their daily lives could prevent privacy breaches, but also how they can act on privacy breaches. And I guess the connection or the link between privacy and technology has been in the media quite recently, not in the health sector, but we had the Facebook scandal, and we have other scandals or other media items that regularly remind us that technology sometimes may impose bigger privacy risks than we were used to in the past. But I would like to put it into perspective that privacy is not necessarily a risk that is introduced by technology. Privacy risks have always been there and always will be there. It doesn't matter which medium you're using. And it's also very important then when a practitioner assesses their risk of a privacy breach to take into consideration holistically more traditional channels like face-to-face discussions in where a patient may still be there, or where they receive a fax and the fax machine actually it gets picked up or being looked at by unauthorized staff, where a phone call is being overheard by nursing staff, or where a letter with patient information gets into the wrong hands. So those what we call more traditional means of communication of clinical information still do pose privacy risks. Today, more commonly, there are a lot of practitioners out there for convenience reasons and for the speed they give them. They use email, they use texting, they're using messaging apps like WhatsApp. And those are just different channels, but they bring with it some very unique privacy challenges. And I will highlight a few of them a little bit later. But something to also not forget is technology is here to stay, and it will complement the work of a medical practitioner or of a nurse or other clinicians more and more in future. So, for example, artificial intelligence already is being used as a decision-making tool in pathology and radiology, and there will be other areas where technology will interlink with the life of a clinician. So, having this in mind, when it comes to the way you as a clinician choose to communicate, and here I would like to highlight it is about communicating or sharing clinical information, which is considered sensitive information under the privacy legislation. So when a clinician communicates, it usually comes down to convenience and speed when they choose the method. But what is also similarly important is to think about the privacy implications, the data security implications, and the record-keeping implications of the method you choose. And I'm often being asked of what's the biggest risk to privacy and data security from your point of view? And to be quite frank, people. It's not technology, it's people. Because it is also very important to keep in mind that potential privacy breaches could be accidental. And that might be the loss of a telephone or the loss of a laptop, the loss of information, but they can as well be intentional. And we have seen privacy breaches where staff, for example, in a hospital are not authorized to access a certain medical record, but they do. So those are more intentional privacy breaches that can also happen. And it's good to keep that in mind. What we do know in reality, when everyone is trying their best to keep working and do the best they can to coordinate their patients' care, but at the same time, obviously not wanting to expose themselves to privacy risks, we do know that 80% of doctors and clinicians out there are already using non-privacy compliant channels to share clinical information. And this includes the Gmail account or other more commercial email accounts. It includes the messaging, includes iMessages on your phone. But the risk is not only that potentially this information can fall in the wrong hands or could be shared onto with people who should not see it. The most bigger risk when it comes to more record keeping and clinical compliance point of view is those informal information sharing most commonly are not annotated in the patient's medical record. And that in itself is a risk for the patient. To give you an example, there might have been a patient who was admitted to hospital, and 2 weeks later, the same person is readmitted with a similar condition. But if there has been information sharing, like there has been texting between the emergency registrar and the VMO in the earlier admission, this information is not available in the record, and it might lead to a delay in being able to help this patient because tests might have to be repeated, or their second opinion might have to be repeated as well. So we know there is this what the privacy legislation changes obviously are something that patients want and that consumers want. They want to have visibility of how their data is being handled, and they want to have the assurance that we're making all efforts possible to keep it safe. From a clinician point of view, we also have to see clinicians want to provide the best care, and that also means they want to securely transmit images, videos, so that they can share information, get second opinions, and being able to help their patients really quickly. But what it also means is clinicians do have a right to ask for, and they should in this stage of technology, to work with tools who are fully integrated into their workflow. And I guess that's where when you look at the link between data security and privacy when it comes to clinical information sharing, it's very important to look at security. And security is to ask yourself, who has access to medical information of your patients? Is it all in digital format, or are there some hard copies? Where is it stored and how is it stored? How long is it being retained for? And how can it be safely destroyed if it's no longer being in use? Or no longer required. So from that point of view, when you look at clinical communication tools, it's usually a very good first call to look for ones that were specifically designed for the medical workflows, because they should take all those points into consideration for you. The second one, when you look at communication, it's much easier if you can have structured communication around patient cases. Because ultimately, when it comes to sharing information, it comes down to the patient's consent. Now, if the communication is already structured, that it's each patient case, it's discussed separately, then it's obviously much easier to decide who should be part of this discussion and in which medical record should this information go. But also being aware of different various levels of compliance. A lot of practitioners work across the whole healthcare sector, both in public as well as in private settings. And slightly different privacy rules do apply in those settings. So just being aware of those different levels of compliance that are required. Again, data security is very much linked to privacy in the sense that we have the obligation to keep sensitive information secure. And that includes secure in access, secure in the way we store, transmit, and also retain this information. But it goes further. Data security and privacy are linked, for example, that under privacy legislation, it's advisable to keep data within jurisdiction. Because if data is stored, for example, on a cloud-based system which has their servers overseas, the obligation is on the practitioner or the user who uses this system to make sure that wherever the location where this data is stored is adhering to the same level of privacy and data protection as Australia. And a lot of us wouldn't know. Then the other thing is very important is to have consent, the patient's consent. Whenever we store or share data, we need to have the patient's consent to do so. And lastly, under privacy legislation, a patient has the right to access their data. So this is something also to be aware. If someone shares in a private email some relevant information about the treatment of a patient, and the patient later asks, how was that decision made? They, strictly speaking, would have the right to access the information that was shared in those informal channels. So it's much better to keep it simple and keep it in the systems available. But also, very important, privacy and data security have a lot to do with simplicity. No one likes complex systems. And what usually happens is if you require someone to go through 5 levels of authorization before they can access information they need, most likely they will not do it, and they will find a different way to get to the information. So it's also simplicity. I have seen a lot of practitioners when I visit their practice who have their passwords just on a little post-it note next to their computer. So obviously they might have a very secure system, but it's not really secure because every patient they see actually knows their password. So simplicity is actually something to think about. Keep it simple. So just to, as when you look about how you can protect private information of patients primarily, in an age where technology becomes more and more prevalent, it's very important to first know where is your information, what type of information do you have that would be considered under the privacy legislation. And this could be the personal information of your staff, it could be the personal information of your patients when they book an appointment, or it could be the sensitive information, which is their health information. The question also, who does it belong to? Is it the patient? Is it yours, or is as a practice, or does it belong to a third party? What's its purpose? Is the purpose of that you collect and store and keep this information that you can provide treatment, or does it have a different purpose? Because if it's treatment related, then you have certain obligation to retain it for a certain period of time, minimum of 7 years usually. But if it has a different purpose of just making an appointment, is it really relevant to keep it for that long? Most importantly, have visibility of who has access and how people can access the information. And here it comes down to simplicity. Keep it to a few channels which you can control and have visibility about. And similar to storage, do you know where information is stored? For example, if you're using mobile phones to have information, they might have automated iCloud backup, and then your information is stored on an international server. And most importantly, when you look at privacy and technology and you're having an assessment, document it. Document what information do you have, who has access, and when it changes, it makes it easy to adjust. And if there is a breach, it makes it easier to react to the breach.